Hello everybody, my name is Julian Pham, and for my microbiology report I'm going to talk about toxoplasmosis, and it is a disease that comes from the parasite Toxoplasma gondii, and that's going to be a eukaryotic organism actually, from the family, Sarcocystidae family. And what's unique about the Sarcocystidae family is that they do require, organisms from this family require multiple hosts and organisms to carry out their life cycle. So we will see definitive hosts and intermediate hosts later on in this slide. And so here we see an example of the intermediate hosts and definitive hosts. So the intermediate will be the birds, the mice, the rats, and from here we can see that the first part of the Toxoplasma gondii's life cycle consists of a lot of cysts. And so really, bradiozoites, so that's going to be the slow growing phase of Toxoplasma gondii, is going to infect the organism and invade epithelial cells, and they're going to start division. And they are slow growing, so when they do get into the organism, they can differentiate right here into tachyozoites, which is going to be a really rapidly multiplying and replicating phase of the parasite. And then from here, these tachyozoites can invade various living cells, as mentioned, the epithelial cells, and use them as a host and just replicate there until the cell just bursts or dies. And then from there, the tachyozoites will differentiate again into the bradiozoites, so into the slow growing phase again, and then just keep multiplying until they form a cyst. Should the cyst be ingested, then the definitive host, so this cat, would actually have the bradiozoites invade their body. And from here, they can either differentiate into that fast, rapidly multiplying and replicating tachyozoite, which is asexual, or they can differentiate into gametocytes, which have male and female counterparts. And these gametocytes can actually fuse to form a zygote that matures into an oocyst. And this oocyst is what's released with the fecal matter or waste of the cat, and that's what humans come into contact with and become infected. So that's going to actually lead us into our next slide, and that's human infection and how we actually contract the disease toxoplasmosis. So as mentioned, it is caused by the Toxoplasma gondii parasite, and there's typically two ways a human person can become infected. So either the creature that they ingest, or that humans ingest, or that humans themselves become the end intermediate host. And so the first way of getting infected is congesting uncooked or raw meats. So especially lamb, venison, pork, beef, just if those creatures are contaminated by the disease and not cooked thoroughly, and we congest it, we actually will initiate the tissue cyst cycle, and that's how we become infected. Or humans can become infected by coming into contact or interacting with that fecal matter from the cat, so specifically cats, and that can include just messing with their litter box, cleaning litter, changing litter, inhaling contaminated air, leaving food in that stale air, and just not washing hands, especially for both methods of becoming infected. But regardless, the tachyozoites originating from either the oocytes or the tissue cysts will localize within the tissue and develop into another cyst, and these cysts are what cause damage to the CNS or central nervous system, cause damage to the brain and muscle, and the cysts can burst based on attacks or pressure from the host immune system. So should our immune system try to attack or get rid of it, it would probably rupture and spread throughout the body and just repeat and then change phases back and forth between the bradiozoites and the tachyozoites, so just infecting more cells. And the unfortunate part is that this parasite can actually survive within living cells for a very long time due to the swapping between phases. So they can actually live inside of a person throughout the entire lifetime until the host dies. So symptoms and effects of toxoplasmosis in humans. So in adults with a healthy immune system, they are typically capable of combating against the parasite and turn out to be asymptomatic characters showing little to no signs of infections. That really it is the immunocompromised and the infected children, especially babies that have come from pregnant mothers who are unaware and have the disease and pass it to their child during pregnancy. Those are the ones who are going to suffer the most and have more severe symptoms and syndromes from the actual toxoplasmosis disease. So all infected, even healthy adults with healthy immune systems, can sometimes still experience flu-like symptoms, including aches and pains throughout the body, fever, vomiting, just feeling sick. And this can last anything from a week to a month, so a few weeks. But they typically will go away. So those with severe cases of toxoplasmosis, that usually comes from acute infections or an infection that had occurred a while ago, and so those suffering with severe cases can suffer major eye, brain, or organ damage. And some of the babies born with the disease, again inherited from an infected mother, will develop worse symptoms later as well. So on this slide, here are some examples of or pictures showing organisms affected by the disease. So here we see a baby with hydrocephalus, and that's when the CNS cerebral spinal fluid, the CFS, excessively builds up in the cranial cavity, and this causes the brain to bloat and there to be a lot of fluid up there. And then this also is often accompanied by underdeveloped eyesight or eyes and other organs, and it can lead to permanent blindness or also just permanent damage to other organs. So this image right here is also of a human eye, or of a human's eye, and it's showing a case of retinochoroiditis. And that's when the toxoplasmosis actually reaches the eye area and infects the back of the eye, typically the retinal area. And again, this can lead to severe blindness, loss in acute just bad eyesight and worsened vision, blurriness, redness, sensitivity to light. So as for screening, testing, and treatment, so according to the CDC, or the Center for Disease Control and Prevention, they propose that approximately 60 million Americans actually are infected with toxoplasmosis, and that these people could potentially develop severe damages and pains with their organs, especially the eyes. And toxoplasmosis is apparently the leading cause of deaths attributed to foodborne illnesses, according to the CDC as well. And so for testing, you can get blood work done in a general blood work done, but typically they will send you to a specialized lab or lab that specializes in toxoplasmosis, just because antibody counting and results can often be confused or misinterpreted by general just blood work labs. So it can be difficult for them to interpret. So again, they'll just send you to a lab that specializes with toxoplasmosis cases. And then for testing and screening babies for the disease, there are two methods. So there is the amniotic or fetal fluid examination, where after a period of time, a pregnant mother can have the amniotic fluid, or the fluid that's in the fetus with the baby, removed and examined, or they can go through an ultrasound scanning. As for treatment, if the immune system is capable of combating the parasite, the symptoms are likely to go away in healthy adults Anything between a week or a month. Again, it takes a bit still, but it would likely go away. So again, with the aches, fevers, pains, you'd feel like you'd have a flu for a bit and then it would go away. So adults or even infected newborns that later on grow can take medication as well. There's pyrimethamine or Daraprim, in addition to the antibiotic sulfadiazine, and these two are often prescribed to people with toxoplasmosis. The Daraprim is also prescribed to people with malaria typically, and with these two, doctors will often prescribe or suggest that the person infected also take extra folic acid as well in their diet. So there's my works cited page, and then really only 10 to 30% of toxoplasmosis infections are symptomatic, but they can result in future pains and damages to your own body or the body of your child if left untreated. Thank you guys very much.